Thank you for asking me here to speak today, and I hope my talk is okay. I'm not used to doing talks like this, only to our families at conference, so this is a bit of a new experience for me. So I'm going to tell you the personal side of a rare disease and how we've got involved and become the charity that we are today, which has actually only been a charity for 5 years. So before our lives changed, I was just a normal mum to 3 children, my daughter and my 2 boys, and everything seemed normal, although in hindsight we did have warning signs. At the age of about 2, my daughter started having coughing attacks. Took her to the doctors. They just said it could well be asthma, but we can't diagnose asthma at such a young age. Take away a spacer and some Ventolin, see what happens. She was having problems as well with constipation, some bladder issues. We then started thinking, oh, there's something wrong with her eyesight. The final idea that something was wrong with her eyesight was just before Mother's Day. It's also coming up to Easter. My mother-in-law had a great big pink plastic Easter egg for my daughter to find in the garden, and it was in a pot right next to her. She couldn't see it. So go, right, okay. Trip to the opticians, and we then had the start of our journey. That was Mother's Day 2007. The opticians diagnosed her with having cyclorotational nystagmus and said she was long-sighted. They then said, we'll refer you to your local eye clinic. We had to wait 6 months for that appointment, and they then decided to do an MRI scan on her because they wanted to find out what the cause of the nystagmus was. No history of it, she'd had no bumps to the head, nothing that would be the normal. So she had a 20-minute MRI scan. They couldn't see anything, so referred us off up to Great Ormond Street. Went up to Great Ormond Street in the October of that year. We had another MRI scan, 50-minute MRI scan, which the staff were absolutely flabbergasted about because she was just under 6 years old, no sedation. She lay there perfectly still for the whole 50 minutes. They then did an ERG, and when we saw the consultant 2 days later, they said, yeah, there's fading of her optic nerve. We can't see anything, any reason why, but she has also got an issue on her brain, so we're going to refer you to neurology. Okay, so a bit more of a wait. A couple of months later, in January 2008, we went for a routine appointment at our local hospital, and I took a urine sample because she'd started wetting at night. This was really, really unusual for her, and it had a bit of a smell. So I asked them to test it. They said, oh, it's come back to like triple positive, but it could well be the container. Go away, we'll do another test. Anything to worry about, we'll contact you. I left it a week, thought I'm not happy, nothing's happened. So I took a sample down to our local GP. They phoned me that day, said, can you come in? There's something not quite right. So we did, got down there, tested her blood sugar. She was rather high. So they sent us down to the local hospital, fasting tests, went back the next day. You've got diabetes, early stage diabetes, so you've caught it. So, great, okay, something else to contend with. Your life changes, you can no longer be spontaneous, because obviously you need to know where you're going to be for your next meal, for snacks, and we had to learn how to do injections on her. Not what any mum wants to do. At this stage, she was about 6 years old. We then started the process of travelling up to Great Ormond Street almost every month for about 2.5 years while they were testing her. They wanted to find out still what was causing the nystagmus, what was the issue on her brain, what was causing her choking attacks. They couldn't give us any answers. She underwent a lumbar puncture, blood tests. They gave us a whole list of blood tests that they were going to do on the endocrine side, and then decided they weren't going to do those. Now, these blood tests, one of the tests they were going to do was for the WSF1 gene. All the other tests I sort of understood. I've got no medical background, but I could understand the others. So I did what any parent would do. I Googled it, wished I hadn't. It came up saying, Wolfram Syndrome causes deafness, blindness, 2 types of diabetes, life expectancy of 30 to 40 years. And I just went, oh, my daughter's going to go blind, deaf, if she's got that. But they decided not to do those tests. She was a newly diagnosed diabetic. She was well controlled. All of the tests still came back with nothing. Skin and muscle biopsy done in 2009, no idea. We then had a referral to a mitochondrial metabolic consultant, and we saw her in December of 2009, and she said, I'm going to run 16,000 tests on what we've got left of the skin and muscle biopsy. Right, okay. She said, take about a year, and you'll hear from me then. Okay, I'll take some blood from you and Dad while you're here. Okay, fine, no problems. We did that, went home, carried on as normal. March 2010, had a phone call. Can you come up and see the consultant tomorrow? Okay, right, there's obviously something. They found something. So we travelled up to Great Ormond Street, saw her metabolic consultant and her neuro consultant, and they gave us the news that I was absolutely dreading. Jennifer had Wolfram Syndrome. They didn't know anything about it. My husband didn't know anything about it. I did. I'd read it 2 years previously. I'm sat in the consulting room, trying to hold it together, while the doctors are trying to say, all we've been able to find is a website, and gave us those 2 pieces of paper. That's all they could tell us. Said, go away, we'll contact you to let you know if that website is still live. We've actually emailed them, and that was it. So my husband's trying to take it in. I'm walking behind as we're going back to the train station, floods of tears, because I'd read it all, and thinking, okay, we've got to deal with this now. How do we deal with this? So we got home, let it digest, and as you do, straight onto the internet. What is there out there? What can help us? Is there anyone that can help us? No, there was absolutely nothing. Apart from this one, the Worldwide Society for Wolfram Syndrome, which did turn out to be still active, although it hadn't been updated for 20 years. So we go, okay, we'll join that site. At least it gives us some hope, some help, some support. But we thought, there has to be other people out there. We can't be the only people. Yes, it says it affects 1 in 500,000 children in the UK. There has to be other people nearby that we can contact. So we started looking a bit more, and we then decided within a week we were going to start a support group. We were going to be proactive and get something happening. We found Professor Barrett, who is at Birmingham Children's Hospital. He was doing research, and still is doing research, into Wolfram Syndrome. So we contacted him, told him what we wanted to do. He said, brilliant, can I also send you some paperwork? I'm just applying for NHS funding for NHS England to set up a multidisciplinary clinic. Yeah, okay. We read it, don't really understand a great deal of this. Yeah, no, it all looks good, go ahead. So he got that all set up, and it's then started the multidisciplinary clinic soon after. 2011, we had our first family conference. I say family conference. We were one of 5 families up at Birmingham Children's Hospital. The hospital staff there outnumbered the families, but it was our first meeting of other people and other children affected by Wolfram Syndrome. So that was the start of it, really. In 2012, we then had what we then turned out to be our worst 5.5 weeks of it all. My daughter had a severe choking attack. We've actually just passed the anniversary of that date, 20th of February 2012. She was eating a chicken nugget. She had one bite. She choked and aspirated. Ended up in the Evelina on ventilator for about 3 weeks. We had 3 failed attempts at getting her off, but the longest she managed to stay off the ventilator was 36 hours. As you can see, it didn't let it affect her. She was absolutely amazing. So the only way to get her off the ventilator was a temporary tracheostomy. 6 years later, it's still there. So we got her over that. We ended up having about 9 weeks in hospital in total, up here in London and then back home. And we then got her out. At that time, she was being fed with the feeding tube because they needed to make sure her swallow was safe. But our fundraising then really started. Because we weren't a registered charity, we had to fundraise via someone else. We linked up with Wellchild, who were financing and financed research for Professor Barrett. So we contacted them and said, we want to raise funds, but we want it ring-fenced for Wolfram Syndrome, which they very kindly did. So we then, we started. So we borrowed the Wellchild nurse, who quite often does the London Marathon, and we got a group of fundraisers who've done road trips for us previously for our local hospices, and they were already geared up for doing something for Jennifer. So they took on the challenge of climbing Mount Snowdon in fancy dress. And as you can see, Nurse Nessa did climb up Snowdon. She climbed up Snowdon the whole time in that costume. So the guy in there was rather hot and sweaty by the time they got up there. We did manage to get some local media about it as well. So it was not just raising the money, but as they were climbing up Snowdon, obviously those sort of people would say, what are you doing? And so dropping money into buckets. So, you know, it was all raising funds for the research because we wanted to find out more about it and to try and find a drug to help find a cure, because there is no cure, there is no drug to help at the moment. So they did that. We had a few other fundraising events in that first year as well. And then in October, November of 2012, we had our first official large family conference, and we were able to present a cheque of £11,600 to Professor Barrett for his research work, which he has said has actually helped him to get to where we are now, about to start a clinical trial. We're about to have our 7th conference this year. So each year it's got bigger and bigger. We've had, I think last year's conference, we had about 96 people there in total, which, considering in the UK there's only about 90 people, adults and children, affected with Wolfram Syndrome, it's really good. So we've got support staff, workers, people that work with them, his family members, as well as those affected. So that's just some of our conferences. At the top there we have some of our WS members as well. That was Professor Barrett presenting last year with an update on the clinical trial that we had funding approved for last year, and we were waiting and hoping to start later this year. In 2014, we did a big awareness campaign. So we went on our road trip background, and we produced 400 information packs, which we delivered to 16 departments within 25 of the main children's hospitals all around the UK. So they went down to Devon, over to Belfast, up to Aberdeen, being the furthest north. And we set them a challenge. It wasn't just, oh, let's go off, we'll have a jaunt. They had a challenge to deliver all of these packs within 60 hours. So they're driving, they're flying, sticking to the speed limits, and they managed to deliver the action packs, or the information packs, like Manchester, Evelina. They did it in 52 and a half hours. So they did go some, and we had vehicles that were all stickered up as well. So that's obviously some of the hospitals that we visited with our packs. We have our families get involved with our fundraising. We had one family, they had a stall at the Dragon Boat Festival close to them, and they actually had a team take part in the Dragon Boat Festival as well. We have an annual golf day. We're just currently organising our 6th golf day for later this year. Last year we raised just over £9,000, which is our largest amount for a single event. We've had a couple of 80s nights. We had one last year, back to school. themed it, and that raised about £4,500 with a number of 450 people maximum. So it was a lot of money that we raised for that. Some of the media, we've managed to get local radio, talking about Wolfram Syndrome. Last year we won our local radio station's award for Charity of the Year. So we're getting known, especially locally for us. And Jennifer, bless her, she did her own bit last year. In February last year, she cut her hair off. Her plait measured about 14 inches. We managed to get it in the paper because she sent that bit of hair off to the Little Princess Trust to be made into wigs for children that have lost their hair through cancer treatment. So, you know, the fact that a child with a rare condition, life-shortening condition, she's thinking of other people while she's undergoing everything that she's having to deal with as well. Then, with the money that we've raised as a charity, as I say, we became a charity 5 years ago in June 2013, we've raised enough to actually be able to afford to purchase a static caravan on a holiday park down in West Sussex. And we offer that to our families at a heavily reduced price. We have to charge them something, because obviously we have to cover the costs. But we have this holiday home, and it's sort of from March to November, so it's there for them to use if they want it. We had a grant from Big Lottery, which we used to produce a handbook to give out to families, to teachers, to hospitals, anyone that might come into contact with a Wolfram Syndrome patient, and it gives them more information about the condition. It gives the doctors more information, because the number of doctors that we have seen in the last 8 years of diagnosis don't know about the condition. It is such a rare condition, and we are teaching the doctors about the condition. We also got funding to produce silicone wristbands, USB wristbands, so patients could put their medical information onto the wristband. That's more for them to be able to keep up to date and keep storage of their notes, because I meant to put it on there. My daughter's hospital file that we've got at home with all of her letters is a lever arch file, and it's that thick. So if I can get everything put onto a USB, it means I don't have to carry this folder around every time we go and see a new doctor. But it's handy because I can flick back to results. So that's some of the funding that what our funds have done. We fund the conference. We don't charge our families for attending the annual conference. So we pay half the cost of their room, they pay the other half. We provide a three-course dinner on the Saturday night after the conference. They have use of all the facilities at the hotel where we have the conference as well. So yeah, all they have to do is pay, say, half the cost of the room and their travel. I know other organisations do actually charge their members to attend the conference. We don't do that. We pay for the whole conference costs for them. I'm there at the end of the phone whenever anyone contacts, when we have a new family. So it's paying for, the funds pay obviously for our daily costs as well. So we then go on to where we are currently. So we've helped Professor Barrett with funding for the research, and he has actually received more referrals since we became a support group and then a charity. He's had more referrals for new patients. So the number that he started off with has grown. And obviously we're pushing him to find us a drug to try and help treat the condition. Because obviously at the moment for the diabetes mellitus it's insulin. For the diabetes insipidus it's desmopressin. Eyes, it's glasses, white canes. Hearing loss, it's hearing aids. Then you've got anxiety, depression, respiratory issues. So it's all other drugs. So they can be taking lots and lots of drugs. So the aim at the moment is a drug to try and find, or get a drug that is going to halt or slow down the progression, which will be basically a sticking plaster until they can find a cure. Now we have, Professor Barrett is working alongside a doctor in America, Dr. Fumi Urano at Washington University, and they have both got drugs that have been repurposed and are ready to go into trial. We had the approval to start the trial last year, but they hit a few hiccups. The patient recruitment should have started in July, but they had an issue with the drug. When it went to Guy's and St Thomas's to be produced and put into the pots and the placebo made, they found that when it comes out of the blister packs, it's absorbing moisture. So they've had to do further tests to try and find out how it's affecting the stability of the active ingredient. So that's still ongoing. They've then had issues regarding the cost of the drug. They were told initially it was going to be 150,000. It now turns out the cost is coming in at 500,000. So our clinical trial has now been delayed by a year. Our patient recruitment can't start. At the moment, it was meant to start this month. We're now looking at April. This is a whole year that we've lost of the drug being given to our patients. A whole year of my daughter, if she's eligible, she may no longer be eligible to take part in the trial, of her missing out on the chance of being on the drug. She could be on the placebo, but she got a 2-to-1 chance of being on the drug. So we're waiting. We are waiting. America, they are using a different drug, and we're going to be trialling sodium valproate. America are currently doing clinical trials on children for dantrolene, because it's not licensed for use in children. So their trial has been going on for about a year now, and it's all positive there. And then we'll get our trial going. The dantrolene will start on a clinical trial. And then the hope and the aims of Professor Barrett and Dr. Arano is to actually do a combined trial. They've already been in touch with the EMA. I've been involved in that as well. And the hope is that we can get the funding for them to do the combined trial, because they think that both drugs need to be working together to help. So this, in the lab, has shown signs of halting or even slowing down the progression. When the trial starts, they'll be using the brain volume and the visual acuity to get their readings to find out if the drug is working. But in the meantime, Dr. Arano is working on a cure. He's doing his damnedest to find a cure. So he's looking at anything and everything. He's working on a super drug. He has said there will be a cure in our lifetime. Whether or not it's my lifetime, my daughter's lifetime, or the younger patients that are affected, their lifetime, we don't know. I just hope it is soon. My daughter has a very different form of WS to everyone else. Hers is a very extreme form because she's had the choking and she's got the trachea. No other patients I know of have got the trachea. So I really, really want this trial to get started. I hope that she is able to take part in the trial. But we've got to wait. And every month that goes past is a waiting game. So we'll just continue to fundraise, to support our families, to support Professor Barrett, and hopefully in the next few years we will get there. So we've also sort of said for Professor Barrett, because he's got this funding, we've actually managed to set aside £33,000 for him at the moment, which will be used to support the families that are attending, to cover the costs of transport, accommodation if they need to stay, because they will have to go several times a year. It'll be 3 months, 6 months, and then every 6 months after that. So to keep the funds that he's got for the drug trial, we're putting in the money to cover the costs for the UK families. And now he's going out to France later in March to talk about where we're at with the trial, because the trial is going to be taking part in France, Spain and Poland, as well as here in the UK. Otherwise, we just wouldn't have the numbers to be able to do the trial. So I think that's it. Thank you for listening.